community center. I'd like to thank the county and Commissioner May. I see Ms. Janice Gilley out there. I'd like to thank them and the board for allowing us to do our press conference here this morning. We are here as part of this, being here today. As you look outside out front, we've started the first collection point for testing for COVID-19 here at the Brownsville Community Center. So now, in addition to Sacred Heart on the east side, we have a location on the west side. It is in the county, but of course, I think I could probably pick up a rock and maybe make the city limits, or at least I could tee up a golf ball maybe and hit the city limits from here. But we're very appreciative of the county sharing these services with us. I think it just, again, illustrates the cooperation that is happening between the two entities at this particular time. Over the weekend, I received a lot of emails, personal messages, texts, phone calls, many communications from all of you out there. I fully understand that this is a challenging experience, both from our health standpoint with the virus, but also obviously the economy. Over the weekend, I watched a couple of different things. I always love history documentaries, just understanding and seeing, again, how things have moved through crisis. And I certainly think now is the time that echoes what FDR said when he said that we have nothing to fear but fear itself. There certainly is a lot of fear out there. It's almost palpable. You can feel it, whether it's the economy or whether it's the virus. But what I want to do today is tell you that we are not afraid here at the City of Pensacola. One, we're not afraid of the virus. We're going to get through this. When you look at what's happening in there and the things that are going forward, the virus is out there. People have contracted it, but by and large, what we're continuing to see is survival rates in that 98, 99%. So we're going to come through this. So then the question becomes, and the penetration rate is still very low. So then the question becomes the economy. And I realize there are a lot of you out there who are having concerns about this at this particular time. One of the things, I appreciate several of you sharing the challenges and some of the actions that were taken, unfortunately, by government that will be shutting down your ability to make a living or severely curtailing it. I totally understand. But in exemplifying that I don't fear where we are, and I fully expect us to make a full recovery in what we're doing. This morning, I've had an executive memo that I've asked the city to, effective today, to suspend the salary payments to the mayor of the City of Pensacola not associated with requirement for benefits, and to donate those monies to what we're doing through Pensacola Energy and the sanitation services to pay those individuals who are out of work right now and aren't able to pay. Now granted, this isn't going to make a tremendous drop in the bucket, but what I want to communicate to you is I'm not afraid. If I was afraid for myself, I would be doing something to retain that. But I'm not going to ask you to lose your salary if I'm not willing to do the same at this particular time. The next 2 to 4 weeks, we're going to be dealing with this. We're going to be trying to deal with an unprecedented event, and we're going to be asking you to take actions that may seem unnecessary that we've ever done before. But we will come out of this, and over the next 2 to 4 weeks, we will be formulating a plan. I told you I spent much of the weekend looking at documentaries, and I can tell you, I don't care what it is in American history, whether it's the Revolutionary War, whether it's World War II, wherever it is, in the very beginning, there certainly are dark days as we are learning to deal with something that is new to us. But the one thing I can assure you about Americans is we eventually figure this stuff out. And I can tell you in Northwest Florida, you have leadership that's doing that right now. And I wanted to at least say, for my part, that I was willing to be a part of that and to suffer the same sacrifices that you and your family are going through at this particular time. We will get through this. We will find a way. Right now, we're testing, and if you feel you have concerns, we want to ask that you call the telephone number here, which is 850-746-2684. We want you to call that number and look at going through the questionnaire to be tested. They will ask you a series of questions. If they feel like you warrant testing based on that screening, they will give you a number, and you will have the opportunity to come here to Sacred Heart and get testing. If you get tested, we ask that you immediately go back and quarantine yourself. If you are suspected a person under suspicion of, IUP, and I can't remember what that is, but if you're a person that is under PUI, person under investigation, if you're a person under investigation, we ask that you go back and quarantine yourself. You do not need to spread this. Even if you don't have it, whatever your symptoms are, we ask you to go back and quarantine. We ask you then to wait for that information and then follow the instructions of what happens. We've had 3 cases that are confirmed that have come back from the testing at Sacred Heart. I'm sure there'll be more as we go into the future. But the good news is none of those cases at this point, or at least last night when I was getting confirmation on notice, that any of those were in the hospital. So at this particular time, again, you may get the virus, you may get sick, but not everybody's going to have to go to the hospital, and that's what we want to avoid as much as possible. So those are good things that are happening out there. I can tell you right out here, we had over 20 people that are out there risking themselves and their health to do testing. And so when I see what's going on here, when I see the sacrifices that are being made by others in Escambia County and Pensacola, it certainly makes me proud of this community in Northwest Florida. We will get through this, and as I've said before, we are also working towards economic solutions and recovery. When that time comes, we will be ready to recover. But at this particular time, if you have the opportunity and you need more, if you're in retail, grocery, or a variety of other business, you need more assistance in doing anything, we ask you to please get with the chamber. There are people out there that have lost their jobs at this particular moment, and if you're one of those people, we ask you that you contact those individuals and look at trying to find ways to mix match where resources are. If you are at risk or you're older, we ask you to perhaps at this time be looking at self-isolating yourself and quarantining yourself. If you're younger, if you don't have any necessarily things that may compromise you in this, we need people to continue to be involved in providing goods and services and keeping our economy going, our food distribution going. So all of these things are critical. At this point, I'm certainly very happy to share the stage today with Commissioner May and Chandra Smiley of Community Health. I'm going to ask them to come forward and say a couple of things about the drive-through center that's here before I go on and communicate anything more about necessarily what we are doing at today as far as the City of Pensacola. So at this point, I'm going to ask Commissioner Lumon May to come forward and provide some remarks from the county.
Thank you, Mr. Mayor, and thank you again for your leadership and your partnership. We do want to thank Community Health and all of our medical partners, Sandra Smiley, Sandra Donaldson. We really appreciate you bringing resources to this side of town. Brownsville has long been the anchor of Pensacola, but many times neglected in opportunity and resources. And so today, for me, it's very important, it's very significant for this community to be able to come and set up testing. But it's very important, as the mayor stated, we have some difficult days ahead, but collaboratively together with our media partners, with our faith-based partners, with our city and county staff, we're going to get through this. I have our administrator, Gilley. We made some decisions this weekend on closings and some protocols that the county has put in place, and so she's going to go over those real quick before we give the mic to Ms. Smiley. Ms. Gilley.
Yes, thank you for the opportunity. I just wanted to share with you that we have closed all county buildings to the public, but you will see that there are many ways in which you can still continue to get your services and different guidance from the county, either whether it's alternative ways, through phone, through appointments, or through in-person, but it would be probably outside. So please know that the county is continuing to provide services to you, all those essential, critical functions that keep our community continuing. For example, solid waste, we've had no changes at Presidio Landfill or the Oak Grove. But if you do have any particular services that you are not able to find out the way to get those versus coming to a building, we do have a Citizens Information Center, and you can call us at 595-4900, and we will direct you to those particular services for you. I did want to share something. As we continue to fight this invisible enemy, I would ask everyone to continue to come together, support your neighbors, support the community. I just met with all of our department directors, and one of the things that we talked about was, yes, we could all probably go home and cook a hamburger, but why don't you buy a hamburger from one of our neighbors? Why don't you buy a spaghetti meal? I know that a lot of our businesses are providing family packs. They're trying to also get in concert with this new normal that we're experiencing right now. So if you're able to give them services or provide them some type of way to continue to go, I think that's keep in business. I think that's important for all of us to consider that. There are thousands of our community that are part of the hospitality and the service workers that we want them to keep their jobs. We want those businesses to be open when we get through this. So anything that you can do as a community, please try and do that. Eric Gilmore is here from our emergency management. We have implemented activated a couple more of our emergency essential functions like mass care, the nonprofits and those kind of groups, so that we can start looking at how we would bring together all the volunteer organizations to start providing services. We have mentioned to you previously as well that we'll be doing food distributions through our libraries and our community centers, and then we are looking forward down in the future to also be helping the school district students that may not have a lot of, they may have limited connectivity with their internets to be able to continue with their schoolwork as our schools are still closed. So please, as I said, everyone I think that the mayor's been very clear. Our message has been stay calm, stay clean, stay healthy, and just try and continue to support each other as we continue to go through this.
Thank you, Ms. Gilley. And we are collaborating with the city and our community centers. Leroy Williams is here, and he's partnering with Lawrence Powell and Claire Long. Brownsville Community Center will be a feeding site. We're partnering with the school district in the Evanwood, in the Oakcrest area, and talking with the superintendent. They have 5 sites, and I think Leroy will be up to about 18 sites coming next Monday. So every neighborhood in Escambia County will have access to nutritional meals for children. Unfortunately, we won't be able to put one on every street, but at most of our libraries, community centers, and majority of our schools, we will be feeding. Thank you, Mr. Mayor. Ms. Smiley.
Thank you. I want to thank the mayor for his support, and I also want to thank Commissioner May for partnering with us to be able to bring another access point for testing here at Brownsville. Commissioner May's staff, Leroy and Claire, have been remarkable to work with, and greatly am appreciative of your support. I got some healthcare warriors out there that I also want to acknowledge that have suited up to be here for this community and for us in getting us through this. Dr. Michelle Greer Hall has been our lead physician for this event, and I want to acknowledge the work that she's put into clinically giving us advice and as an organization helping us through this. So again, we're here 9 to 1. The mayor referenced that call-in number, and we want you to call, go through the screening process, and for those who need the test, will be directed either to this location or to the Sacred Heart location that was stood up last week. And I want to close, you mentioned talking about history. The greatest generation was birthed out of World War II. And there's going to be a great generation that's birthed out of this. And back in World War II, it was young men who were picking up guns and going across the world to fight. And ground zero and the warriors today are their health care. So thank you for your support. Thank you again for your partnership.
Thank you, Chandra, for what you're doing at community health and keeping all of our, certainly those that are most vulnerable in our community with an opportunity to access to health care. We certainly appreciate that, and we appreciate the county and our partnership here. Again, there were several things that have gone over about this center, and of course the Sacred Heart, and the number is 850-746-2684. And again, those are things, if you could call there before you go through the screening, and then you'll be able to come forward. We want to make sure that access is available to everyone. One of the challenges that will happen is you will see, obviously with more testing, we probably will see more confirmed cases. But again, knowing that you have a dedicated health staff. We have 3 great hospitals with healthcare workers all over who are dedicated, that have put aside their private practices to take care of this health pandemic. They're there. We have the resources in this community, and we are going to get through this. You may see positive cases, but please know that those individuals are working hard to make sure that we can care for everyone that gets this virus here in our community, and that we can move to recovery. Toward that end, again, we had 3 new cases that were confirmed as of this point, so that brings our total to 4 in Escambia County. Dr. Lanz has stated that these results reinforce how important it is for individuals to get tested, and we ask that you do that. Again, the Florida Department of Health, Escambia County encourages residents and visitors to take steps to protect themselves from this respiratory illness. Everyone has a role to play in preventing the spread of this virus. We need you to follow the following steps in all situations. Even if you feel perfectly healthy, avoid close contact with others, such as hugging, kissing, and shaking hands. I think we've all gotten adjusted to that over the last week. Avoid large gatherings, more than 10, and stay 6 feet away from each other. I think this is one we're continuing to work with, but again, we asked over the weekend, we had a couple of things, and I want everybody, certainly exercise is important, but we had a few instances where we had people get over 10 people. And we understand at this particular time you're looking for things to do, but we ask you this is for not just your health, it's for the entire community's health, that we need you to stay away from these large gatherings. So if the police come, if people ask you to disperse, if you're in groups larger than 10, we ask you to please comply and continue to work with them. Avoid unnecessary travel, especially international and cruise travel. Avoid being around anyone who is sick and who may have a weakened immune system. Wash your hands often, especially after coughing, sneezing, or blowing your nose, and disinfect and frequently touch surfaces in your house. We certainly are doing that here. I know Leroy was referenced earlier. I couldn't be here without recognizing Robert Greer, who Robert makes sure we're clean at City Hall, and we're doing all the precautions we need to at our city facilities. We encourage everyone to continue to follow these recommendations. City updates. On Thursday, March 19th, I announced the declaration of state of emergency, and with new business restrictions for the City of Pensacola, and I also asked that all healthcare nursing homes suspend social visits, and most of them have closed at that point, which is good. The restrictions will be in place for 2 weeks, and we will continue to reassess the situation and determine how that order will change as we move forward. The executive order from Governor DeSantis, the city is following this executive order 2071 from Governor DeSantis, which also suspends on-premise food and alcohol consumption for restaurants and establishments. And as Ms. Gilley said, we've moved to takeout and delivery, and we ask that if you have the opportunity and the means to do so, that you try to help some of those businesses in what they are doing. The order also requires the closure of gyms and fitness centers in Florida. Food distribution is critically important. I think Commissioner May mentioned that. We have meal pickup sites for youth. The City of Pensacola is partnering with Feeding Gulf Coast to offer grab-and-go meals for youth ages 18 and under at several of our city community centers starting today, Monday, March 23rd. The meals will include a lunch and a snack, and they will be available on first-come, first-served basis. Breakfast items will start being served next Monday, March 30th. The meals will be available for pickup at the locations of Cobb Center, which is 601 East Mallory, Fricker Community Center, which is 900 North F Street, Gull Point Resource Center, which is 7000 Spanish Trail, and Woodland Heights Resource Center, which is 111 Berkeley Drive. Those are the places that we will have youth meals available. We will also have senior meals working with Council on Aging. They will have pre-plated meals for seniors, weekdays 11 a.m. to noon. These meals are available for pickup at the following locations: the Cobb Resource Center at 601 Mallory Street, and the Bayview Resource Center, Senior Resource Center, which is 2000 East Lloyd Street. Seniors must call Council of Aging. That is 432-1475. You must call the Council of Aging before noon, the day before you pick up. So if you want to pick up tomorrow, you need to call before noon today for the ability to pick up tomorrow, Tuesday. The number is 432-1474, and we ask that you do that. Parks managed by the City of Pensacola remain open to the public during this pandemic. But park visitors should not use playground equipment, park benches, or other shared surfaces. And also, we ask you to limit the congregation. Again, we had several parks where we had people over the weekend get higher than that 10. We ask that you please work with us, and if we see groups larger than 10, the police will come there and ask you to please disperse. This is not just for your health, this is for the health of the community. Current evidence suggests that the survivors cannot survive on services for several days, can survive on services for several days. According to the CDC, the City of Parks and Recreation is not able to disinfect these as frequently as they are touched. We encourage families to continue enjoying open spaces at the city's 93 parks. Park visitors should bring their own equipment, such as a ball or frisbee, and CDC guidelines should be followed, which means social distancing and staying less than 10. The City of Pensacola Parks and Recreation has taken the following steps to protect all of the public. All drinking fountains in the city have been turned off, and the city's splash pad at Plaza Luna is closed until further notice. The Pensacola International Airport. At this time, the Pensacola Airport is open and fully operational. The Pensacola International Airport is required to remain in operation until the federal government determines a need to place restrictions on interstate travel. That is not a decision that remains solely at the discretion of the city. Travelers who are not feeling well are encouraged to stay home and reschedule travel plans. Some airlines are waiving cancellation fees, and please check with your airline. And at this point, these are all the notices we have. I'd like to close in the sense that also, another president said, certainly John F. Kennedy said, that's not what your country can do for you, ask what you can do for your country. And I think at this point, your city of Northwest Florida needs you to do things for your city. The things we've asked for you here to continue to do. One, first, think about your own health. If you're at risk, please shelter yourself and quarantine yourself. If you feel that you're sick, please quarantine yourself. If you're able-bodied and feel fine, we need people to continue to participate in the economy and moving things forward, and we're working on that. But be diligent and kind about where you are and recognize opportunities you may have to serve your fellow citizens. Follow the instructions of what your local governments are telling you, and take time, especially if you have elderly neighbors, to help them and assist them. If there are opportunities you have, since you're not, if your time is more free, if you have the opportunity to help them obtain food, either by a meal or something at the grocery store, please help them. We're going to get through this together. As I said before, we have nothing to fear but fear itself. And it's time for us now to realize and get out of the fear and to realize what we can do going forward. We will recover from this economically. I'm totally confident of that. Every day that goes by, we're doing a better job of understanding what we need to do as a community and assessing the right steps for us as a community to not only survive the health crisis, but also to position ourselves for recovery. We'll continue to take this period, even though the city buildings are closed, and we're looking for you to operate with us online. We are not closed. We are continuing to operate, and your city employees are still there. Your sanitation services, your Parks and Rec, your other services, police and fire are all there working to take care of you. So again, we will be out there. We will be looking to take care of you. We simply ask that you follow the things that we're asking you to do. If we do all that together, which I know the people in Northwest Florida will absolutely do, we will get through this and we will be prepared to come forward. I'm now happy to answer any questions. Andrew.
I was arriving. Could you just briefly recap this with the payments, paychecks and stuff? You said that.
That's for me personally. I said there's nothing. One of the biggest things I've seen over this weekend is there's a lot of concern, and I understand that from an economic standpoint and personal. I made the decision this morning to suspend the payments for the mayors, and I simply have the ability to do that. I then donated that money to taking care of sanitation and Pensacola energy bills. But my feeling is I'm not going to ask you to do anything and I realize some of the restrictions we have and what we've done have restricted people's ability to make an income. But I'm in this boat just the same as you, and I'm not afraid of where we're going. I'm confident that we're going to get through this. And I'm confident the measures that we're taking that this is going to get better. So at this particular time, I'm not afraid. The worst thing we can do is continue to deal with the fear of the uncertainty. We've got to get past that. and I'm willing to take precautions and put myself at risk and my family because I'm not fearful of what the future will bring. I think we absolutely will get over this and we will recover as an economy. Yes.
And just going off what you said, so you said there were 3 new cases from the Sacred Heart testing site that brings Escambia County up to 4 now?
Correct. The question was just confirming that we have 3 cases out of the testing that was done at Sacred Heart. That brings the total at this particular time of confirmed cases in Escambia County to 4. That number will probably go up as we're testing. The good news is obviously the majority of the people that tested were negative. So again, the penetration rate is still low in our area, but we do expect as we continue to test that those numbers will go up.
I have a question for Chandra if she's available. So here we have a droplet testing site and also a food distribution site for children. What's being done to make sure that those populations are kept separate?
So we've been working with Leroy and Claire here at Brownsville. I think,
as you know, this is the largest community center. The distribution in Leroy is here that can help you, but the food distribution will be in the back. We have a back parking lot, and that's up front, so those populations will not cross paths.
And also for you, Chandra, it seems like one of the patterns we're hearing is that, Sacred Heart has these pieces of the puzzle, Baptist has these pieces but not that piece, and it seems like if we could all 3 work cohesively, maybe even with one phone number, because now Baptist is standing up their site, what's being done to coordinate all of those resources, phone numbers, drive-up appointments, all of that?
So we are in partnership with Ascension Sacred Heart, so we are sharing the same number. I have staff over at their call center, so they're shoulder to shoulder, answering the calls and working together on what would be the best location from access point to refer people to. I do know that the CEOs from all 3 hospitals are meeting regularly, so, and on that inpatient point, they are collaborating and working together. And certainly, we are communicating what we're doing with the hospitals as well.
It just seemed like Baptist said they didn't have swabs, but they have the analyzer, and obviously Ascension Sacred Heart has swabs and reagent kit,
Yeah.
which parts are missing? That's kind of what I was getting at. So
I think the good news is they all are working together. They all are communicating. I know this got started with Commissioner May reaching out to them, and they've been working with me as well. We had them at a press conference on Thursday. And so for all three hospitals and also community health, I think as we go through this, anytime you start something, there will be hiccups that we're doing. The thing I noticed, I was there Friday meeting with Justin and Dawn at Sacred Heart, and what they told me, where they were Friday was unbelievable light years ahead of where they were when they started this Monday and what they were able to do. I think you're going to see the same thing here. I know there's several Ascension people, I believe, out helping you. They're training. So as we go through this, we're going to be getting better. But there's no doubt, I think that was also some things before you came in, Andrew. I was trying to say that typically, if you look at Americans, whether it was World War II, a number of different things in our history, when things start, we sometimes have challenge because we're learning. There's a steep learning curve. Right now, we're having a steep learning curve with this virus. But we're going to get, there's one thing we do always. We end up figuring it out, and we end up putting our resources to bear. And I think that will happen both with the health virus as well as the recovery. Yeah, absolutely.
And just in response to that, I did want you to be aware that with the activation of ESF8, which are the medical and health sections, one of the things that our team has been working on all weekend with the support of the hospitals and with the community health clinic is that we are trying to get for you all a very robust report regarding the testing, because I know that that's a consistent conversation that we're having. How many tests, how many positive, how many negative, what's that look like? So Eric Gilmore has been working with each of the hospitals. They have all said that to the best of their ability, they are going to provide us each afternoon the number of tests that they've completed that day, and then be able for us to provide to the commissioners and to you all the actual list of those numbers, because I think that's one of the main concerns that I think the press and the community has in general, because I think whenever you're looking at the number of positives or the number of negatives, without knowing the entire population that has gone through that testing, I think that's where some of our concern is. So we're hoping to calm those fears from that perspective, and we're hoping, as I think the mayor said, as with anything, we started it on Saturday, we got a little bit better at it yesterday, and we're hoping to be better at it today. So I think that will also provide you with some information that will that you can pass on to the public that will be reassuring as well.
Chairman.
In other areas, officials have said that testing, in order to conserve medical supplies and tests in general, that testing be restricted to healthcare workers and those that actually need to go to the hospital. Is that at all the case here, or you're still encouraging?
I think all of those places you've referenced are places that have said they've gotten simply community spread and they're beyond the position of what testing helps them. I think at this particular time, I continue to say we're not there in Northwest Florida. I'd like us to continue to stay there, whether we can or not. It will certainly depend on some of the measures that we're taking. But I think we're not there yet. Now, we may get to that point, but my understanding is most of those communities are communities where it's fairly highly significant. You're talking about your Los Angeles, Philadelphia's, New York. Half the people that are contracting this and are sick with it are in New York. So, again, these are things that are happening in the state of Florida. Most of the people at this particular time that have it are in South Florida. It's not to say we can't see increases here or substantial things go up. But until we do the testing, we don't know. So from our standpoint, we need to continue to do the testing to figure out what do we have and what we're fighting. If we get to a point where it becomes that community spread, then we very well may take those actions. I think we said this last week. You're going to see us continue to change as we hit certain thresholds. But at this point, we're not there.
Any discussion on having one hospital treat non-related COVID-19 patients?
We're letting all three of the hospitals work through that process. I don't believe any of them are necessarily overrun at this particular time. That we've got to come to that question. The question was, are we going to why shouldn't we have one hospital focus on patients that are not COVID and allow the other part? And at this particular time, we may get to that as we go through that. We have not seen any of the hospitals be overrun at this particular time. That's not to say, I'm not saying that that's not going to happen. I'm simply saying it's not happening at this particular time. And as long as it's not happening at this particular time, we'll probably keep pursuing as we are. That's one that we'll be looking for all the hospitals to work together. They're very concerned. This is why they wanted to push out as much testing and as many things as we could do out of the regular hospitals so that those could treat we still have people who have illnesses and disease and recovering and other medical issues that just simply have to be taken care of. So that's why those hospitals will continue to work on those, and we'll be looking to try to do our COVID in other places if we get to a point that we have to think about those decisions. I'm sure the healthcare companies will be thinking about that.
And can I mention?
Yeah.
So as I mentioned earlier, we have activated the ESF that deals with mass care, so that I do want folks to be aware that we do have a plan in place. So please do not be concerned that we will run out of space for particular treatment, okay? So please do not have that fear. I have every confidence in the team that has been put together to work on that. They've already identified facilities. So please do not be afraid if we do happen to have a mass run in terms of the need for health care, okay? Because we do have folks that are actually already preparing for that and clearly have identified facilities and places for that. So I don't want that to be a fear.
What are some of the facilities that they
So the team just activated today, and I think they will be in a better position to tell you once they have actually communicated and gotten that plan together. But they are currently in the planning process with those facilities and those conversations. So as soon as they're able to share that with you, we will. But they are currently working with those to make sure that they have all the plans actually in place. So.
Is the county doing any work as far as working with the state to bring in more medical supplies? We hear about shortages of masks and things. And can you kind of tell us what?
Yes, I mean, I'd be happy to bring Eric up and have him answer specifically, but I will tell you that we are getting shipments in. We've gotten a couple of shipments already, and his team is actually starting the distribution of those shipments. So Eric, if you want to come and be a little little bit more specific. But we are getting them, so that's why I'm saying, please don't be afraid. We are actually getting equipment and supplies in that are being distributed. So we are not seeing shortages that you should be afraid of,
So for a week now, we've been receiving requests from ALFs, nursing homes, home health care providers, hospitals, law enforcement, first responders, the potential shortages that they have currently. We're asking them to continue to work through their vendors. Of course, we know there's backlog on vendors and everything. They're still working with their vendors and their providers, but the state is starting to receive some of this PPE in. We did receive a shipment yesterday that went out to community health and our hospitals. We're trying to fill those frontline healthcare workers right now. And then as we get more in, we're understanding we'll receive another truck later this week. I don't have a specific date or what we're getting, but we did receive limited supplies starting yesterday. So this thing should start rolling into the area. We do have a plan in place to receive those and reallocate those out to the community.
How much comes in a shipment?
I said, so it's going to be hit and miss right now. What the state did is they pushed everything they had. Escambia County received 2 pallets, which is, I think we received around 2,195 masks. We received some isolation gowns, gloves, face shields, things of that nature. Now, it wasn't a lot, granted, but it was something. There's a lot of counties that didn't receive anything throughout the state. We was one of the identified counties that receiving shipments, so. Thank you.
And the hospital said on Friday that they're all 3 well-stocked at the moment.
At the moment.
Admiral?
Yeah, upon entering the building, Mr. Mayor, I saw the preparations being made outside, testing, but I also saw a sign saying no walk-up testing. Can you explain that?
There is no walk-up testing because what we'd like you to do is there's a pre-screening. We don't have enough testing for everyone, and so if you just simply want to find out, listen, I'm a hypochondriac. I'd probably be out there wanting to know if I had it or not. I'm not exemplifying any symptoms. I don't need to take a test from somebody who really has it. So that's why we're asking for you to call. And I tell you what, I have that number again and trying to make sure we have that. It's 850-746-2684. 850-746-2684. And all of you online, TV, radio, print, certainly as you could get that out there, that telephone number, that would help us. We appreciate that. I was going to say also real quick, there was earlier, we talked about, not ask what you can do for your community at this particular time. There are places, if you're so inclined and have the feeling that you need to give and help, certainly I know many food pantries, whether it's Manna, whether it's right here at Brownsville, Assembly of God Church, there are many food pantries that need your assistance, that are finding their supplies getting low. So please find a way to contribute to them. There are also many people that deal with, such as we talked about, I was contributing to the need for both your gas bills and your sanitation services. We also, the city works with Community Action Program, Council on Aging, and Salvation Army are also all entities that take donations and deal with making utility payments for individuals. So again, if you're so inclined and have the means and the opportunity, we ask you to help. We certainly understand if you're struggling because you can't at this particular time earn for your family. We understand that. What we're asking for is those that are, that find a way to get in the fight and help, and that's what we're trying to do.
Sorry, I wanted to answer that question.
Just to add, for the walk-up question, we do recognize that many of our patients do not have transportation. And so today we're doing drive-through, but we are looking at how can we accommodate patients who do go through the screening process but may not be in a vehicle to do the drive-through. So we're working on how to address that. Not ready to stand that up today, but I do want you to know that that is something that we are aware of.
If people screen through for a yes but don't have a vehicle, what do you do with them right now?
That's what we're trying to work through.
We would try to work through something that we could set up a walk up here, but we certainly have people who walk to our Jackson Street location and have been for the past week, and we have an outside screening process that we've deployed.
Chairman.
So you said there are 3 cases in Escambia. Is that from like Monday's testing?
That's my understanding. Those are from the first set of tests.
And should we assume that all the other tests taken that day came back negative, or no, just that name, like just some come back? Or?
I don't have that total, but that was my assumption. I'd heard they had processed through the Monday ones. So again, I don't have everything sitting for you, and I'm sorry about that. We did just have the positive confirmed, but we can reach out and we'll be sure to place that through the JIC that we're doing. I see PIO from the county and our PIO, and I know that we'll get that information out. Yeah.
You mentioned city parks. There were some social media pictures that went around this weekend, large crowds out there. At what point, if people don't comply with the CDC guidelines at city parks, at what point will you consider closing parks?
There's always that option. We would hope that people would comply. We're trying to reach out with the police. It's my understanding we certainly had an incident at a park playground with a basketball facility on 12th Avenue that had one of those occasions. I also understand at Bayview Park we had a significant number of people. I mean, the challenge is we're all being cooped up, and I think part of it is access to outdoor and fresh air. I know my wife and I walked. I had a chance to play some tennis over the weekend with some people. Figured we're we're fewer than 10 people. But again, those are things. I think exercise is a part of us continuing to keep a proper mental state, a proper immune system state. So I don't want to get to a point where I'm discouraging people from getting outdoors and doing that. But we are very clear about we do not want you. We ask certain things of you. This is one of those times where we're asking something of you, and we would ask for your compliance. Please stay away from getting into groups that are 10 or more. That's what we've got to get away from.
Mayor, I had a question that Dave Dunwoody sent in to me. He was asking why Roger Scott Tennis Center remains open.
It's the same reason. We hadn't necessarily looked at quarantining. We certainly will look at reducing the number of courts we're playing on, but I do feel that outdoor, we have our tennis court open at Bayview. We have our tennis courts open in front of in Armstrong Park. We have tennis courts other places that are open. I believe that exercise and fresh air is going to be a part of how we work through this. I think all of us saw we can't just simply stay in our homes, which is going to drive us crazy. Our mental health standpoint, we've got to be able to get outside and have some of the parts. That's what we hear you. We don't want to close those things totally down. We want you to have access, but we expect you to do it with the responsibility we're asking. This is a trying time, and again, we will ask of you not just what your city can do for you, but ask what you can do for your city, and that's comply with what we've asked you, Jim.
I know the number went up on the how many in Escambia County. How many are actually in the hospital?
My understanding from what I got from Sacred Heart is that none of the individuals that tested positive are in the hospital. So at this point, they're still quarantined at home. That could be because the case they have is again, it says 98%, 99% survival rate, and that's our goal is to test. We're testing. I think we'll see the survival rate continue to go up and the death rate go down. That's the whole goal of what we're trying to manage with the social distancing is push the death rate down. So again, 99% of the people survive this. We need to be planning for the recovery in the future, and I can tell you that we're doing that. As we come out of this, we're going to be prepared to come out of that. Don't be afraid where we are. I realize everybody's going to be going through some tough times, and I'm not asking you to do anything that I'm unwilling to do myself. And that's what I tried to do this morning with the order that I asked. And so at this particular time, I'm trying to participate and be right there with everyone else out there. I realize how challenging it is, but I'm not afraid. And I want to be clear, I don't think any of your leaders that are up here are afraid. They wouldn't be up here putting themselves at risk and putting themselves at financial risk if they were afraid of what the future may bring.
The health department just came up with it's now 5 cases in Escambia County. 2 of the cases are non-travel related. You said earlier you don't think there's community spread, but the 2 cases non-travel related. What are you hearing from the health department? What are they telling you about what is that threshold?
At this point, they have not communicated to me that they thought they had something. If they do, we will be in contact with all of the other hospitals and the Department of Health, And if they so advise us, we will make those decisions at that point. So again, we'll leave this press conference and we'll probably reach out and we'll ask for that advice.
People who screen for a test are then asked to self-isolate for 2 weeks, right?
Correct. Correct. My understanding is the individuals who tested, who just got this back, I think we're close to 1,000 at Sacred Heart now over the week that we've been there. All of those people should be back at home. They were asked to go back and isolate. The same thing will be happening. I think this morning before we came into the press conference, I'd seen 4 people go through already. So, we're beginning to see those things happen. And if you come here and get tested, we expect you to also follow the guidelines which we give you, which is to self-isolate. We need to pull you away from the rest of the individuals in the community.
I'm not sure who would answer this best, but people who work in restaurants are already stressed, obviously. They face the prospect of losing income for 14 days if they come forward and volunteer for a test and screen positive. What's being done to encourage them to come forward as opposed to just keep on making a paycheck if they are?
Well, I think at this point we've been advocating for both the state and the federal to come up with some solution, and you see the things that are happening in Washington. I mean, last week I came out with a letter asking the governor to look, and also a federal delegation to look at something like a claims facility. I don't pretend to have the answer as they're working through that. I do expect them to get something passed, and I do expect them to give relief to those individuals. And I do expect those individuals, if you think you're sick, to stay away. That's one of the most key. We have individuals right now who we think are at risk only in the sense of not because they're sick, but are at risk of individuals. We've tried to send and platoon as many of those individuals' employees home to quarantine themselves. We would ask the same thing to happen. I very clearly said, if you believe you're at risk, I ask you to take the opportunity to stay at home and figure out what you're doing and communicate with your company where you are and what needs to be happening. But again, we still need people to be involved in our food distribution. We need healthy people involved in our food distribution. So that's going to continue to be a very important part.
How's that going, Mayor? Is that going well right now? People complying with carry out and all that?
As far as I know, I've not seen anybody that hasn't been. I've heard almost all the restaurants that we've seen, different things that are going to carry on. In fact, I know that last week you couldn't go in, you almost couldn't go in a fast food restaurant. They had already gone to take out. So, I think it's one of the things that we're seeing most people comply with. And I think you heard Ms. Gilley. If you have the opportunity and the resources to do it, please help out some of these companies. That's what we're trying to do, and trying to make the best of it. The only way we're going to get through this is working together. And again, I think of, certainly that FDR quote, but again, this so many times in the Bible and Scripture, you see where the angels come in and they say, "Fear not," because fear is the biggest enemy we have at this particular time. If we can get over our fear, we are going to get over this. We're going to come through this. We're going to come through this as a stronger nation. Whether it was Hurricane Island, whether it was the financial crisis of 2008, whether it was the oil spill, we have come through these crises. We'll come through this coronavirus, this COVID-19 as well. We just, at this point, we cannot get wrapped into our own fear.
It's kind of for Eric, I think, but obviously the ordinary surgical masks, not the N95s, may have some positive effect. Has there been any thought of doing public distribution of those? I don't know what the supply chain for those looks like.
Sorry, I didn't hear your question.
So I know there's been a lot of talk about the N95s, and that's vital for the workers, but even the surgical masks that some of the folks outside are wearing do have some benefit. Has there been any talk of a public distribution of those, or is the supply chain even available for that?
So those have had a hit as well, because typically as a responder, somebody dealing with a healthcare situation, that's the mask you put on the sick individual. So we have had a run on those as well. But as we said, the manufacturers are starting ramping up. The supply chains are somewhat coming in. State of Florida is starting to see resources coming in. So I hope that our needs get ramped up a little more. We meet that need in the next week or so. I couldn't tell you when, but yes, I do know we are using those masks, and they do have some limited help in what we're doing. So, but everybody's still sought after the N95 is still the mask sought after for.
And didn't previously the Surgeon General had not recommended
Yes, so the Surgeon General did recommend it. Individuals not take up the N95 supply if we get those to the healthcare frontline workers, paramount, to get to the mass to those people, so.
I just meant more in the sense of anything that might be possible to do. The surgical masks are limited value, but they're not zero value.
Right.
Better than coughing your arm. You know? Could that be a public service to provide people with those?
There's a lot of information out there, and you go on the internet right now and find people who have said this works, or hey, I manufacture this at the house. I don't have the scientific research on all those, but there are things out there. And as we get those in, we are trying to send those out to our healthcare providers, to our frontline people, and to the public to say, hey, have you thought of using these things? So as those things do come out, we are trying to get that out to the message to the public. So
I would say, if you have the virus or if you're a person under investigation, I absolutely think you should be looking at how you can do the mask. The one thing I'm fearful of saying, yeah, go get the mask, is again, everybody goes out. It's like the test. We don't have enough to test every person. We have the test ability to test every person that actually has symptoms. I don't have the ability to go test everybody. I would say, unless you are actually having symptoms, you're a person under investigation, or you've been diagnosed with the virus, allow those people. Those are the ones that would need that mask. And I agree with you, Andrew, that they ought to be the ones having it. But I want to make sure that we're not having a run on masks, because those are the individuals that need it. The individuals who are healthy at this particular time, they're not the ones that need the mask. Thank you very much for being here.